Hi, I'm Tony Fields. I work with Dr. Kevin Witte and Dr. Kathy Gaumer in Regain Functional and Regenerative Medicine. We're going to be presenting on staying in the game, making our patients feel better, function better, and move better. Today's presentation is going to be more oriented to the golfing community, but in fact, the game can mean whatever you want to put in there. It can mean your relationships, it can mean your work, it can mean your play, it can even mean your relationship with yourself. And so we're going to take a look at how you stay in the game, how you stay in the game of life. Who is Regain? Regain specializes in functional and regenerative medicine. What is functional medicine? Functional medicine is simply utilizing healthy hormones, vitamins, minerals, enzymes, and even the right food choices in order to make your cells behave more healthfully and more youthfully. Regenerative medicine is harnessing the body's natural capacity to heal itself, super concentrating that, and putting it in the places that we hurt. Our location is, we're in Leawood Fountain Plaza. It's 11111 Knoll Avenue, Suite 218 in Leawood, Kansas. And there's a beautiful picture of our facility. Let me introduce you to our doctors. Dr. Kevin Witte is a native of Windsor, Missouri, and graduated medical school at the Kansas City University of Medicine and Bioscience. Kevin completed his orthopedic sports medicine fellowship at the Andrews Institute Research and Education Institute in Gulf Breeze, Florida. Dr. Witte's surgical practice, Sano, has two locations, St. Luke's South and Overland Park, as well as his surgery center in Lee Summit. Dr. Witte leads our regenerative medicine team. Dr. Kathy Gaumer earned her undergraduate degree in cellular biology at KU and went on to attend medical school at the University of Kansas Medical Center. A board-certified OBGYN, Dr. Kathy Gaumer has been practicing since 1995. Kathy's expertise is actually tailoring functional medicine treatments for her patients in order to create and maximize optimal functional health. She's engaged in treating our men and women, as well as training our staff, and as well as leading our training center. The overview for our presentation today is Dr. Witte is going to talk about golf rehab, how to stay healthy. Dr. Gaumer is going to talk about getting healthy in terms of functional medicine, and I'm going to talk about getting healed if you're injured with regenerative medicine. And then following that, we'll have some questions and answers.
Hello, my name is Dr. Kevin Witte. I am the director of the regenerative medicine side of Regain Functional and Regenerative Medicine. I'm an orthopedic surgeon specializing in sports medicine, and I'm going to talk to you today about golf injuries, how to prevent injuries, and stay healthy for the game of golf. You know, golf is one of those games that we tend to play more as we get older, as opposed to other sports. A lot of times it's a younger sport in other areas, but in golf we tend to play more as we get older. And so it ends up being a lot of overuse injuries. Now there's studies showing that it's best to limit play to 4 rounds per week and no more than 200 balls at the range per week to try to minimize those overuse injuries. So golf injuries, in 2015, a study was performed and showed 131,000 injuries reported to either the physician's office or to the emergency room. Of those, back injuries were the most common, but for women, elbow injuries were the most common. Overuse and poor swing mechanics had the highest correlation to injury, and then carrying the golf bag and walking had a high correlation with back injuries, shoulder injuries, and ankle injuries. And the average time lost for an injury is 28 days per injury. So 80% of golfers spend less than 10 minutes warming up. Now, this is a big deal. There are studies showing that if you warm up, you can reduce the number of injuries by half. And the key number is 10 minutes. Spend at least 10 minutes warming up. And when you warm up, you want to stretch the entire body, not just the shoulders and the elbows. Focus on your hamstrings as well as your back and your core. Strengthen the hip and the legs. And don't forget cardiovascular training as well. A golf warm-up. Spend 3 to 5 minutes of exercise to get the blood flowing. Stretch the back, shoulders, triceps, hips, quads, hamstrings, calves. Spend about 30 to 60 seconds with each stretch. Now, dynamic stretches, progressive golf swings tend to do better than just static stretching when you reach and hold the stretch. But as long as you're doing some sort of warm-up for 10 minutes, that's the key. Some of my favorite warm-ups are the crunch or curl up, protecting your back, doing a slight crunch, keeping one leg up. This is all for the core, to get the core warmed up and ready to go, and part of a regular exercise routine you can do to prevent golf injuries. Another one is the bird dog. You're going to switch legs, alternate hand and leg. You can see this on our website. And how to do this, you're going to alternate and hold this for, again, 3 to 5 seconds with each side, and repeat. The side plank, again, engaging the core, the obliques. You're going to try to get those core muscles going. You're going to hold that plank to the side just like you would do for a front plank. Now the front plank is another good core exercise to work your abs and your lower back. Lower trapezius area. So the shoulders and your upper back, lower traps are important in the golf swing. So you can get on a medicine ball or on a table and you can reach out and really squeeze your shoulder blades together, hold those. Again, it's going to be a hold for 3 to 5 seconds and repeat. External rotation. So rotation of the glenohumeral joint of your shoulder is really important. The internal rotation and the external rotation. So when you're laying down on a ball again or a table, exercise, bench, you can really hold these shoulders out at 90 degrees, externally rotate, hold, and squeeze. And then you're going to internally rotate. And you can repeat these. Again, these can be done with a small amount of weight or just with body weight. The push-up plus. Now this is going to work underneath the pec area around your back, what we call the serratus anterior. You're going to do sort of a push-up, but you're not going all the way down. You start in the push-up position and you shrug your shoulders down and then shrug your shoulder blades back up, arching your back. For dynamic stretching of the hamstrings and quads, you're going to do an exaggerated walk. You're going to kick forward, you're going to step down and kick back, curling your hamstrings. So again, this is going to engage your quadriceps and your hamstrings, kind of like the old forearm running we used to do in sports in elementary school, kind of an exaggerated walk. Another dynamic hamstring stretch you can do is either up against the wall, or you can lay down and do a push-up position and then try to slowly walk your toes up to your hands. This is a more advanced technique, but it's a really good stretch for a hamstring, lower back. In addition, it'll get your wrist and forearms to try to prevent some of that tennis elbow, golf elbow that people get. And again, just a classic quadricep stretch is pulling that leg up behind you, curling, holding, reaching forward so you can really engage the core as well as your hip flexors and that quad muscle. Dynamic core stretches. Do windmills. Windmills are good for warm-up as well as for stretching. You're almost starting in the jumping jack position, but you're going down and you're reaching for each toe and you're alternating back and forth. Again, a more advanced technique, but a lunge. So step out into a lunge and you're going to twist back and forth. Again, holding your core tight, keeping the back straight, twisting back and forth to engage both sides. This can also be done standing with a golf club. Warm-up versus no warm-up. Now there's a 24% increase in club head speed from week 1 to week 7 with a specific warm-up program. And again, that was a 10-minute warm-up program done in a recent study. So not only is it going to help you with injury prevention, but it's going to help you with performance. We've talked about preventative practice as it relates to injury and how to stay in the game on the field. What if you have deeper issues that are disruptive to healthy functioning so that you don't feel good, your body doesn't work like it should, and your motion is impeded? Kathy is going to review our functional treatments that are designed to make you feel better, make your body function better, and restore your life motion.
Hi, I'm Kathy Gaumer. I am the Medical Director of Regain Functional Medicine, and you've been through some information about how to stay in the game and how to prevent injury. Now we're going to talk a little bit about functional medicine, which is all about how to get your body healthier on a cellular level. Better physiologic function is what we were used to when we were younger. Better cognitive function was also part of our younger days. And as we get older, those things tend to change. And it's not necessarily our fault. It's just our body's not having what it needs to function and work at its most optimal level. Cardiac disease also seems to worsen with age. So we're going to talk about all three of those different areas individually. The ultimate goal is to make you feel better, make your body function better, and restore your life motion. So let's get started. So usually when I give this presentation in front of a live audience and I start talking to them about hormone replacement therapy or particularly testosterone replacement, usually the audience gets one of two things in their mind. First is usually someone that looks like this, which is kind of the guy that's really pumped up at the gym. He works out for hours every day, and usually testosterone in this setting is not something that's within normal physiologic levels. These guys are using super physiologic levels and sometimes illegal medications to achieve this type of result. That is not what we do at our office. What we do is try to restore your testosterone levels to a healthy level to allow your body to function better. The second thing that most likely comes into people's minds is increased sex drive. Now, obviously, testosterone replacement in both men and women definitely improves libido and improves sexual function. However, what we're going to talk about today will show you that testosterone and hormone therapy really affects every cell of our body, from our mind and our brain function to our skin and our hair, all of our internal organs, and it's not necessarily just related to sexual functioning. So what are the benefits of testosterone therapy? We're going to go through this in greater detail, but just in looking at this slide, you can see the poor little guy on the left really wants to be the guy on the right. So everything, as we said, from improved brain function and mood, reduced chance of dementia and Alzheimer's disease, reduction in body fat and increasing lean muscle mass, as well as muscle strength, increased bone strength and bone density, and obviously plenty of energy and just a general improved sense of well-being. So let's go through functional medicine and aging. The aging body is increasingly unable to produce needed physiologic levels of hormones, and this inability triggers health decline associated with these negative health markers. So what are these negative health markers? Well, typically in a live audience, I have everybody stand up and I start to go through some of these symptoms, and by the end, and I ask them to sit down if I hit a symptom that they are very familiar with or has happened to them. And typically by the end of the list, everybody's sitting down. So what does that mean? It means that everybody's affected by this. It's not unusual to have these symptoms as we get older. It's a normal part of aging, but we now have ways of improving that and changing it. So let's go through some of the symptoms. Irritability, obviously mood is a big factor and it affects everyone. Fatigue, especially towards 3 or 4 in the afternoon, you're just feeling tired and your brain's dead, you can't function very effectively either at work or at home. This then is worsened by insomnia, either difficulty falling asleep or early waking in the early morning hours and inability to fall back asleep. Forgetfulness, again, brain function, particularly for high-functioning people in very demanding jobs, is typically very stressful. And for them to not be able to have adequate brain function, particularly in the afternoon, it can be very stressful and distressing to them. So hormones can help improve that function and really keep you sharp later in the day. Heart palpitations are just changes to the cardiac health in general, becomes increasingly apparent as we get older. If you look at cardiac centers and the cardiac care unit in really any hospital, what you'll find is men in their 40s and 50s and older, and then women typically in their 60s and older. Why is that? Well, we now know that estrogen is cardioprotective, and that's why it takes a little longer for that cardiac risk as women age to catch up to men. Obviously, as we're talking about women, we all know all of the signs and symptoms of menopause: hot flashes, night sweats, mood changes, as we said, vaginal atrophy, which is the changes in thinning of the vaginal tissue, which then can make vaginal intercourse with your partner almost impossible for some women. Obviously, loss of sex drive and loss of libido are a big factor, and not only just for yourself and your own satisfaction, but changes in libido definitely affect your partner and intimate relationships. So what does hormone therapy or testosterone replacement therapy do for the aging body? Optimizing the messenger hormones testosterone and estrogen is health creative and measurable in at least 3 different areas that we're going to address today. For body health, better physiologic function; heart health, better cardiovascular function; and brain health, better cognitive function. So let's talk about better physiological functioning and body health. What does that really mean? Well, hormones can help increase bone density, improved lean muscle mass and muscle strength, improved stamina, especially during your workouts. You have much better energy during your workout, have a much better ability to get through it with continued energy, and typically can continue your workouts and feel better about them rather than feeling incredibly fatigued at the end. You're sleeping better with much deeper sleep, so you feel refreshed in the morning rather than waking up and feeling fatigued at the beginning of the day. There's less body aches and pains. Why is that? Because testosterone actually is an anti-inflammatory. It works to reduce inflammation in the body, which then improves not only muscle strength and bone density, but reducing the aches and pains that go along with weakening of both of those 2 areas. So testosterone also will help provide you with stronger immunity, so you're less susceptible to normal cold or viruses. You have faster recovery, as we stated before, after workouts or just your normal day-to-day activities. So continuing with physiologic function, positive body changes include, as we stated before, increases in lean muscle and reduced body fat, particularly around the midsection, which typically occurs around midlife, both for men and for women. Those changes are normal, but obviously hormone replacement can help reverse those changes. Better physiological performance at the gym, improved workouts, improved stamina, and of course better sexual functioning with improved libido, and discomfort and pain that some women have is greatly improved, and that typically occurs relatively quickly. Increased protein synthesis, and what you eat finally is you're able to see the results. So patients who are dieting who don't have their hormones replaced tend to become very frustrated because whatever they do, they're not seeing the results that they want. They might reduce their calorie intake, they're working out all the time, but they hardly see that the scale budges at all. When we replace those hormones and your body has what it needs to function properly, then you are able to see the results of your hard work, both diet and with exercise. So it does give you motivation to continue doing all of the good things that you've started. So let's talk about cardiac health. What does testosterone and hormone therapy do as far as heart health? Well, we know that there's a better cholesterol metabolism, and that means an improved HDL, which is the good cholesterol, and a reduction in LDL, or bad cholesterol. There also is an improved glucose metabolism, which reduces risk of diabetes, and diabetes and heart disease tend to go hand in hand. So when blood sugars are chronically elevated, it does increase not only the risk of obesity, but it increases the risk of high blood pressure and cardiac disease. Improved vasorelaxation, which means improved elasticity of the blood vessels, which then reduces risk of high blood pressure, which is, as we all know, the silent killer, which a lot of people don't even realize that they have until it's too late. So lastly, let's talk a little bit about brain function. This may not seem as important as cardiac function or heart health, but it actually is probably the most important of all. When we replace testosterone or replace hormone therapy for women and men, we have increased mental stamina, which means that you're able to concentrate at a much higher level. You're able to function mentally at a much higher level. And for a lot of people who are at very stressful jobs that require a lot of intensive thought process and they function at a very high level, this is very important for them. We do know that increased mental clarity allows them to function better at work as well as at home. Their mood is better, they're not as stressed, and they have a much more positive outlook, or what we call general sense of well-being. Everybody that feels better and functions better mentally is going to have a much better mood and outlook on life. So better brain function has been looked at with multiple studies throughout the years. We looked at studies from 1999 through 2005, and this recruited men of all ages from the age of 40 to 80. Over 2,000 men were involved in these studies, and all of them basically came to the same conclusion, which is better cognitive performance was found at an older age when normal testosterone levels were noted at a younger age. So during midlife, the higher the testosterone levels for these men, the better cognitive function that they had when they got older. This is exciting information, and new information is being looked at as far as specifically for Alzheimer's as well. And the testing was done on visual acuity tests as well as general cognitive tests. So any test that was given to these men, the higher the testosterone level, the better the cognitive function as they aged. So functional medicine is actually improving health from the inside out, meaning at the cellular level. So the poor health markers associated with aging can actually be successfully resolved and reversed. Our patients report that they feel better as their hormone levels improve and stabilize. They feel better. They didn't realize how bad they felt, but now they feel so much better. They realize that the hormones have really significantly improved their lives. Their bodies function better physiologically and cognitively, as we've said. Both brain function, cardiac function, and physiologic function improve and stabilize, and they really show significant improvements not only in what they see on their day-to-day lives, but also in the laboratory evaluations. We see those changes at the cellular level. Lab tests consistently demonstrate improved health, and we enable our patients to stay in the game, whether that's work or play or in their personal relationships. You don't nearly need to survive aging. We can actually thrive with aging and improve the way that we can manage our midlife and older age life. We don't have to sit on the sidelines and watch our younger family members enjoy and travel and exercise and do what they want to do. We all want to stay in the game by whether that's golf or tennis or pickleball, whatever your game is, traveling, being able to run after your grandkids. We all want to be able to enjoy our lives through midlife and into our older years.
We're talking about staying in the game, whether that game is work, play, relationships, and Dr. Witte's talked to you about PREHAB, about keeping your body healthy before activity, especially golf. Dr. Gaumer's talked about creating a healthy body, needing those optimal healthy hormones to help us in our aging. So essentially intervening in the aging process so that we age better with strength and vitality and fun, actually. But what if you're injured? What if you have joint injuries or you have chronic pain and osteoarthritis? So we're going to talk about regenerative or Regain's regenerative treatments, because some of you may be struggling with some of those things and it's actually put you on the sideline and you're not moving, and because you're not moving, you're not actually living to the fullness of what your life could offer. So we're going to take a look at those regenerative treatments. The first thing we want to do is actually present you with a list of things we treat. We treat Achilles tendons, tendonitis, tendinosis, the swelling of the tendon, degenerative tendons. We treat back pain, lumbar and cervical spine, cartilage defects, golfer's elbow or tennis elbow, whichever sport you're thinking about, hip pain, knee pain, peripheral neuropathy, rotator cuff injuries, runner's knee, and ankles, plantar fasciitis, those sorts of musculoskeletal issues. The first thing I like to talk about is the results that we get. 80% of the patients that we treat have an 80 to 90% pain reduction. 17% of the patients we treat have a 30 to 80% pain reduction, and 3% of our patients are non-responders. It's important to know that some patients don't actually respond to the treatment. So how do we quantify that? We have WOMAC surveys. In those WOMAC surveys, there are 25 questions with a pain rating of 1 to 4. And so the patient will check off their pain level for the different activities from 1 to 4, 100 being the most pain and 0 being the least pain. Most of our patients who are coming for these treatments, their pain levels are usually 7 or 8. In 3 months, we give them the survey again. We bring them back and we review what's going on with them. We give them the survey again, and usually their pain levels are around 40. So that's a 40 to 50 level pain. In 6 months, the pain levels are usually down to around the 10 to 20, and some patients have no pain at all. But we're able to quantify that and qualify that with the actual patients filling out the pain survey. So those are really good results. That just indicates that we're able to keep you moving, keep the pain levels down, and keep you engaged in your life. I like to start out when we talk about stem cell therapy or regenerative medicine, I like to start out with my own Achilles. That's my Achilles 3 years post-operative. My leg was completely swollen. It was blood was pooling. I ended up with a blood clot in my leg, and I lost the function of my left foot. And so we were going to do stem cell injections on my Achilles tendon, and that's what it looked like the day that we did the injections. This is what it looked like 2 days later. Now you can see that pooling, that blood pooling and that swelling, it's practically all gone within a couple days. And this is what my Achilles tendon looked like a month later. Now, what we like to point out is that with this Achilles tendon, it's visible. But a lot of us have hip osteoarthritis in the hip, or rotator cuff problems, or we have cartilage loss in our knees. And the beauty of this treatment with my Achilles is very visible. So we can actually see what happened with the Achilles tendon. And that is what happens in the joints of our patients. We see this kind of visual is actually what you can't see that's going on when we treat your shoulder or your knee or your hip. What we're going to talk about in this overview is we're going to look at what are stem cells, how do biologics work, what's the cost range and what's the cost range of the procedure, and then we'll do some questions and answers. So we like cord products. We like the new products because they're actually, we call them new versus your own bone marrow and your own mesenchymal stem cells. Cord products are healthier because they proliferate more frequently and for a longer duration. A stem cell, a new mesenchymal stem cell will proliferate every 24 hours for 60 to 90 times. An old stem cell will only proliferate every 5 or 6 days and will do that for 15 revolutions. They're also more potent, and that means they're more likely to differentiate. They're more likely to get that regenerative activity that we're looking for, and the product is much more consistent versus it kind of being a guess if we're going to use your own bone marrow. These new cells also stimulate your own cells to participate in the regenerative activity. So as we age and as we have this, we lack this homeostasis in our joint, and our cells aren't really dealing with the inflammation. We put these new cells in, it's exciting for our own cells, and it turns on that regenerative and that healing capacity, so our own body sort of picks up the pace and begins to engage in that regenerative work. The different kinds of products we use placental-derived amnio product. It's rich in collagen and other structural proteins, has lots of growth factors that support soft tissue repair. It does stimulate, it's stimulative of our own endogenous cells. That means your own cells. We also like Wharton's jelly. We're going to do a little deeper dive into that. And we like exosomes. Those are the primary products we're using. Now, Wharton's jelly. So you could see here where the Wharton's jelly is found in the cord. We like Wharton's jelly because it provides cushioning and support for the joint. So most of us, when we're treating our joint spaces, we lack space, we lack that cushioning, and we lack that support. So Wharton's jelly is a lot like a tissue transplant. The Wharton's jelly is minimally manipulated, and it provides cushioning and support in the cord. So when we put that in the joint, it has a much better response in terms of pain relief and joint function because of the cushioning and support provided by that Wharton's jelly. Studies indicate that Wharton's jelly has the highest concentration of stem cells, it has the highest concentration of hyaluronic acid, and the highest concentration of growth factors. That makes it the best product for using in osteoarthritic joints. Our products are minimally manipulated. A lot of Wharton jelly products are put in sort of a grinder, or they're liquefied, and that it does real damage to the cells and the growth factors. The products we like to use are minimally manipulated. It's literally like a tissue transplant. New cells are better than adult cells in these important ways. They proliferate faster, more frequently, and longer. Their potency, they're non-lineage new cells, and they're more likely to differentiate, and they're more likely to stimulate your body's cellular differentiation. They're stimulative. These new cells stimulate endogenous regenerative activity, and they also produce more potent exosomes, which are these little information packets that actually turn off inflammation and turn on regeneration. So if we get down to really the basics, what is a mesenchymal stem cell? According to the International Society for Cellular Therapy, this is what a cell, to be a stem cell, has to have two minimal qualities. It has to be renewable. So the cell has to double, like we're seeing in that slide. The cell has to double or duplicate. This is called proliferation, doubling, or duplicating. For a cell to be a stem cell, it has to be able to proliferate. The second, it has to be able to differentiate. In medical terms, this is called potency. This is the capacity for the cell to become any other cell in the body. So for a cell to be a mesenchymal or mesenchymal stem cell, it has to be able to be self-renewable, and it has to be able to differentiate. We're going to look at that in a little bit more detail. So what do stem cells do? A mesenchymal stem cell is a progenitor cell, and it has these regenerative mechanisms. So the first thing we see is what we talked about, the cell's ability to proliferate or to double or duplicate in the space we put it in. The second quality it has to have is it has to be able to downregulate inflammation. And I kind of like to pause here. When I'm talking to an audience, I'll say, how many of you have osteoarthritis? And lots of people raise their hand because we're seeing people with joint pain. So they have osteoarthritis in the joint. How many of you know what osteoarthritis is? And no one knows that. I've never had a seminar where someone actually said osteoarthritis is this. Or inflammation. How many of you have inflammation? And they raise their hands, but they don't know what inflammation is. So in order to understand how a mesenchymal stem cell works, we have to actually understand what it's doing. What is the mechanism? This is the why behind what you saw in my Achilles tendon. So what are they doing? I'm going to pick out one inflammatory protein or one particular inflammatory cytokine. It's really prevalent in osteoarthritis, and it's prevalent in the joint space, whether that's the hip, the shoulder, the knees, and that's called interleukin-1. Interleukin-1 is an inflammatory cytokine, and it is a cell killer. If we think about our bodies, our body is made up of cells. We're all cells in our body. Our body does not like cells to die. Our body likes cells to live. When you have cells dying, you're like, let's think about the knee capsule. When you have cells dying in the knee capsule, you basically have loss of space, right? So when you get an x-ray of your knee and your knee's in a lot of pain, you have osteoarthritis, and you see that space lost, it simply means those cells that were there aren't there. Something killed them. Interleukin-1 is that cell-killing protein, and that's driving the inflammation. So what do stem cells do about downregulating inflammation? They secrete an anti-inflammatory cytokine. It's called interleukin-1 receptor agonist, and that is the counterpart to interleukin-1. So stem cells are attracted to these inflammatory signals, and they secrete this cytokine that actually turns off that inflammation. And that's why we see in the joint space, what we're treating, we're not merely suppressive of the problem, but we're actually remediating the problem. So the first thing these stem cells do is they turn off those nasty cell-killing cytokines. So now we've stopped the cell killer. The second thing they do is they fight apoptosis, and that's simply a fancy way of saying cell death. When a cell is dying, it sends off a trauma signal, and the stem cells are attracted to this trauma signal. Why is the cell sending off a trauma signal? Because it wants to live. When cells live, we keep tissue. When cells die, we lose tissue. So these cells that are dying or the apoptotic state are sending off these trauma signals, and the stem cells are attracted to those trauma signals, and they provide what's called trophic support. That simply means the kind of nutritional support that cell needs to go from an unhealthy, dying state to a healthy, living state. What have we done? We've turned off the cell-killing proteins, and now we've actually restored the health of the cells, which means we are saving tissue. However, in most of our bodies, we have a loss. We have cells that have already died. They've already died, and we see the loss of tissue and the narrowing of the joints. We see the bone derangement. We see chippy, flaky bone. So stem cells are able to differentiate into muscle. They're able to differentiate into bone, fat, and cartilage. These are all the things that we need for joint health. So they can become these missing cells, and we can get a little bit of remodeling of tissue. Now that's a bit controversial, so there's arguments about whether in the body a mesenchymal stem cell will differentiate into these different kinds of tissue. We do see tears remediated, and we do see pain function. So patients are mostly concerned about pain. But what the stem cells do is they stimulate your own cells to regenerate tissue. So even if it's not true that these cells that we're introducing into the body are actually responsible for layering cartilage, they do stimulate your own cells to actually get to work. And we've seen that. Our oldest patient is 86 years old, and we've seen his pain levels go down. So this is the what behind, this is the why behind the what that stem cells do, but the patient's experience is simply pain. Do they have as much pain now, 3 months later, and 6 months later, and a year later? That's the final story, but it's good to know what these stem cells are doing that's creating these lower pain levels and enabling our patients to get moving. So when we take the Wharton's jelly and we take that tissue transplant and we put it into the joint space, it comes in a cellular matrix, or these are additional tissues that actually help your body heal and repair. We're going to talk about two of those tissues, cytokines. Cytokines are naturally occurring anti-inflammatory agents. So you can have your inflammatory cytokines and your anti-inflammatory cytokines. When we're talking about, again, about the body's ability to heal itself, we are super concentrating it and putting it where we hurt. So we're super concentrating these really positive cytokines, and we're getting them into that joint space, and we're literally turning off the inflammation in the joint space and stopping that further degeneration. Inside that cellular matrix, there are also growth factors, and there's a host of growth factors, and a lot of them have really long, complicated names. But I like to talk about one growth factor that we find particularly effective. It's nerve growth factor. So lots of patients have nerve damage, and sometimes it's hard to identify the causality of that nerve damage. But we know that neuropathy is due to a lack of blood flow to the area, and so we have these nerves that are dying, and so that will manifest itself in pain or tingling. Some patients can't walk due to that. So in the cellular matrix that we're putting in the joint space, we have these nerve growth factors, and these nerve growth factors are regenerative for the nerve. We also use exosomes. So exosomes are nano-sized information packets that are secreted by the mesenchymal stem cell. These micro-sized vesicles contain regenerative and anti-inflammatory information that they deliver to your own cells. So the exosomes are not cells, they're an acellular product, and they are talking to your cells. They're telling your cells to downregulate inflammation and telling your cells regenerative properties. So there are more than 200 signaling proteins in exosomes. Anti-inflammatory cytokines, angiogenic growth factors, that means the ability to create new blood flow. They help inhibit cell death. They're regenerative, and they have regenerative and healing signals. And they have messenger RNA, or we would call this the on switch. They turn on regenerative mechanisms. They activate anti-inflammatory cytokines. They send regenerative and healing signals, and they also enhance cellular proliferation, which is really important. As we age, or if we have an arthritic joint, we tend to have our cells are dying at a faster rate than we can actually replace them. And we also have a senescence, so we have cellular senescence, meaning the cells are not operating like they should. And so these exosomes really turn on our cells, and they really enhance cellular proliferation. They also have microRNA, or on the off switch. They turn off chronic inflammatory cytokines, and they turn off the matrix of the catabolic enzymes. In other words, that matrix that is actually killing or breaking down molecules and therefore breaking down cells. Some of the things we treat with exosomes, we treat the more systemic problems, chronic inflammation, rheumatoid arthritis, even Lyme disease. So what is the process for an exosome treatment? We have inflammatory blood tests that we run on our patients, and we identify these inflammatory markers. We infuse the exosomes in a concentration depending upon the nature and the depth of the return that we got on the blood work, of the data that we see. And then 3 months later, we have a follow-up blood test to watch those markers actually turn down. And that has a huge systemic effect on the patient's body. To get a patient out of chronic inflammation or autoimmune diseases, we're actually getting them restoring movement and function in their life. What is our clinical process when we're talking about treating a joint? The first thing we want to do is we offer this free to our patients. It's free to you if you're listening to this webinar. You will get a free diagnostic workup. And what that means is that we're going to scan the joint, and we're going to determine the soft tissue damage. Why do we choose ultrasound instead of an x-ray? When we're looking at an x-ray, we already know the joint space is narrowing. So really that's practically all it's telling us. We can see a little arthritis in an x-ray, but mostly we're seeing the nature of the bones. what we really want to look at is the soft tissue. We want to see what kind and how much soft tissue damage is involved. And the ultrasound is our best way of determining that apart from an MRI. MRIs are expensive and they take a lot of time. We actually get a really good reading with our sonographer. Our sonographer is excellent at assessing soft tissue damage. Why do we want to know soft tissue damage? In some joints with some of our patients, the damage is so severe that we will recommend that they actually get a surgery. So if we have a complex tear in the meniscus or a complete tear in the meniscus, that's going to need to be a surgical repair. If we have a complete rupture of a tendon, a bicep tendon or Achilles tendon, we're going to have a surgical repair. So it's important to understand that we're not opposed to surgery. Sometimes surgery is the next best thing to do. So our diagnostic workup at the outset is focused on what is the best next thing for the patient. And we actually know that evaluating soft tissue puts us in a place to make the best next decision. So we review any imaging that you have, we review any MRIs that you have, and then we determine if regenerative treatment is the next best step for you, or perhaps we have to have a surgical repair. We recommend for patients, and we do this, we may repair a rotator cuff, or we may repair some damage or debride a knee, and then we'll use the stem cells after that, and accelerates that healing process. So we want to assess the damage. We want to use the diagnostic workup to assess the soft tissue damage, review any previous diagnostic testing that you've done, and determine what the next step is. If we think that regenerative treatment would be right for you, then we want to have an appropriate plan of action for that, and then we determine the cost of the treatment. So thanks for listening to our presentation. I hope you found it helpful. If you're struggling with any of the things that we've outlined, then please come in. You'll have a free consultation either for our functional medicine or for our regenerative medicine. You'll find that even in our consultative or our diagnostic work is a great benefit to you, and we really look forward to seeing you come in the clinic. We really enjoy helping people. Our objective is that you would feel better in your body, that your body would function better, and that you would move better so that you can actually stay in the game. You can stay in the game of life itself. So come in and see us and we'll get you fixed up.